I'm Elaine and I'm going to be the moderator today.
Mm.
Before we get started, I just want to let everyone know that Dr. Park is going to be going over a lot in our webinar today. Feel free as questions come up as he's talking, you can put them in the little question and answer chat window there. And then at the end, we'll go over all the questions. And then after the webinar today too, we will also send out an email that will have all the information for your offer. So now let me introduce Dr. Park.
All right. Thank you, Elaine. And for those of you that have or haven't been following me, this is kind of a series that Fast Track has been helping our practice kind of organize these webinars. So thank you, Elaine and Fast Track, as well as Dan, who is my web SEO engineer and really helping me get these things together. And of course, Yvette and my whole team. So today, this is kind of a fun topic for me because I wouldn't say that this is the most common surgery in America, but it's definitely a very, probably the most artistic surgical procedure that a plastic surgeon can do, the rhinoplasty. So we're going to focus on the nose today. I've done a talk on a facelift before, but this is going to be the centerpiece of your face when we talk about the nose. So want to just talk a little bit about the history of rhinoplasty and also how it affects me as a plastic surgeon. I have a training background in plastic and reconstructive surgery, and that's important because at Stanford, I trained for a number of years in reconstruction. And I think it's important to differentiate a reconstructive surgeon from a cosmetic surgeon, because if we can learn to do reconstructive surgery to fix the abnormal to the normal, then that leads us to a nice segue to beautify and enhance the normal to nice aesthetics. So this is an interesting piece of history where you can see here, this gentleman here has actually got a nose reconstruction. This was done in the 16th century, whereby the arm was used as a little tubed pedicle flap to reconstruct a nose defect. And if you can imagine holding your arm like this, it had to be held there, a pedicle, for 2 weeks. So you actually have to cast the patient in this fashion. And a gentleman, Tagliacozzi, in the 16th century performed this nose reconstruction. We don't really do this today, but it's a nice piece of history that, again, once we understand how we can reconstruct a nose, then we can lead to the beautiful aesthetics and the examples such as the Mona Lisa here. So I actually had this slide in my previous facelift talk before, and Zoom is just in our culture now during this whole, hopefully post-COVID era. And Zoom has really forced us to look in the mirror. As I'm doing this talk, I see myself and how I look, and social media does it. And of course, all the selfies are really focusing on the nose and the face in general. So plastic surgery has actually really grown due to that fact in and of itself. We see this in our celebrities as well. Most of you know, and we kind of know who in Hollywood has gone through these rhinoplasty experiences, such as Jennifer Aniston or Ashley Simpson there. But I do stress that even though these are known, in terms of an actual result, I really strive for a natural result. And that's what we're looking for in terms of that. So when we talk about who's a rhinoplasty candidate, I do want to take a quick history and make sure things are okay from a breathing standpoint, make sure there's no airway obstructions, because if that's the case, then sometimes I'll work in combination or refer to ear, nose, throat, make sure there's no trauma. A lot of people do report a history of breaking their nose in the past. In that case, we need to remodel the bones in the upper portion of the bridge. But really what we're going to focus on is the cosmetics of a rhinoplasty procedure. So the artistic and science of it, Not to get you inundated with all of these ratios, but there are certain factors and ratios that I am looking at, again, from an aesthetic point of view. So for example, you can see that the line is drawn in fifths, and we can see the width of the nose comes right in between the inner parts of the eyes right here. There are certain ratios we look at for nose projection. So those are just all of the numbers that I'm kind of thinking about in my head. But what we're going to really focus on is to kind of simplify it is 3 areas. Most of patients coming in are looking to look at the tip. We're looking at the dorsum, which is kind of the bridge. They may say they have a hump. And finally, sometimes people will point out the width of the bridge or the nasal sidewall. So the rest of this talk will be really focusing on those 3 elements and also how they combine with each other and affect each other. So if you think about the nose, and I use this analogy, there's kind of a tripod theory. Again, going back to those 3 elements, we are looking at the nose in terms of how it projects. And if you look at this tripod and then compare it to the diagram above, we do see that the nose sits almost kind of like on a tripod here, and that if I affect the nasal sidewalls, they're going to affect the tip and also the hump, and all will affect each other. So as I'm analyzing every patient, and you guys may have heard me talk about this before, there's always a scientific approach. And again, those are those numbers and measurements that we're looking for. But the most important part, and specifically for rhinoplasty, is the artistry and that artistic nature of sculpting the nose. It's such a centerpiece on the face that it's very important for your plastic surgeon to have a very creative eye. And then I always use, and you'll often see me or hear me allude to pictures or models. Going back to those Hollywood celebrities, it's okay to bring in a profile so that I get a good idea of what type of profile you're looking for. I would like to show this funny picture. This is not me, but I was a violinist and grew up playing the violin for a number of years. My mother was a violin teacher, so I didn't have much of a choice, but that really instilled in me a creative background, and it has really helped in me in my career. This is I thought a very artistic picture by my 6-year-old daughter. It's a self-portrait of her, and I think it may sell for millions at the Louvre. We don't know, but what I found interesting is she drew a pretty perfect nose here. We look at the dorsum, it's very straight. She's got good tip projection, and everything looks really sharp there. So she's got a good eye already, and perhaps my daughter will join me in plastic surgery someday. But when we talk about artistry, and this may be dating myself, but if you're old enough, you'll have seen this old movie with Patrick Swayze and Demi Moore, and they're sculpting the clay, and it's very romantic. But not to say I'm doing this in the operating room, but I am sculpting just like Patrick Swayze is here, and that artistry is really important there. So let's dive into what people come in to get addressed. So the hump, that's probably the most common thing that I see in the consultation. And it's simply, we see the bridge at the top being a little bit rounded and projecting, and we definitely just want to smooth that out. Okay, but and a little bit about, people think that we're just shaving down the bone, but we do want to note that the top third is the bone right here, and the lower 2/3 of that hump is actually cartilage. So our goal is simple, it's to reduce the hump, and we know that it's both bone and cartilage, so we reduce the hump. So here are some before and afters. Now, this is where I feel that model and that picture is very important, because you can see that this person has a certain profile that I've produced here, and it's nice and curved. And this one has a little bit softer curve. And then again, this one has even a gentler curve. And finally, some patients may want a straight profile. So this subtlety, here we go, once again, pretty curved in the upper left. Then we're going to a softer curve and even yet almost a straighter profile. And finally, one may say they want a straight profile or bridge. So again, these are 4 elements of the subtleties of how I need to listen to you in terms of what your goals are. Now, if we affect the top of that bridge, you can almost imagine in like a tent analogy. If I shave the top of this tent, it creates kind of an opening on the top as shown here. So that's why I have to create little bony cuts to bring everything together, bring that tent together. And what this is going to do on these little bony cuts is reduce the width of the bridge. So we're going to tackle the top of the bridge and the base of the nasal sidewalls. So here are the lines on the befores that you're seeing a pretty wide bridge right here. And then this is the after. We want to narrow that bridge down. Second patient, same idea. The width of that nasal bridge is narrowed down. So that's the approach there. Finally, the tip is something that's very complex, and it's the center, the tip lighting. We want to contour. This is actually a contouring photo, but there are many angles I'm looking at. But the most important thing is I do want to keep it natural. I want to avoid a pinched look, and I want the skin. People can have different tip. Why is one person's tip different from the others? It's because some people will have thicker skin than others. But the point is we want to narrow the width of the tip as we see here, so we have more defined tip. So here are some examples. Again, also in a female, if you look at a profile, we want that tip to slightly be elevated so it's nice and feminized. So how do we do this? The tip is made of these 2 cartilages, and I'm simply working on removing a little bit, shaving the cartilage, suturing it together to give you tip definition. And that's the goal, to define the tip definition right there. So once again, we can look at varying people of different skin thicknesses. A lot of it has to do with ethnicity as well. So for example, I'm Asian or Hispanic, African American. We tend to ethnically have thicker skin. So if I wanted a Brad Pitt nose, that wouldn't be possible. But for example, my beautiful wife, who's Norwegian and has blonde hair, blue eyes, has very thin skin, and we can get much sharper definition with that type of ethnicity as well. So everyone's got some genetic differences, but you can see in all of these, our goal is to narrow the tip. So finally, a little bit about recovery. I would have to say that this is probably the most easiest in terms of recovery. A lot of my patients say very minimal pain, and the splint is removed in 1 week, and you can literally go out into public. There is some bruising you can cover up. Exercise in 2 to 3 weeks. And the only thing we have to be a little bit patient of in terms of any surgery, whether it's breast, tummy, or even nose, is the tip may linger a little bit of swelling, even up to 3 to 6 months, just very minor, and we're going to be patient on that. All right, so in conclusion, I did want to show 3 of my favorite women that are near and dear to my heart. Once again, my daughter, who's 6, demonstrates a perfect nose, and my beautiful wife, hi Ashley, who is the centerpiece here. And this is a very nice before and after, whereby again, she had to twist my arm to do her rhinoplasty. She's perfect, was perfect, and is even still more perfect. And you can see how, again, the dorsum and tip are defined. And then Dr. Eric, whom you know or has put or will put you to sleep, is my anesthesiologist, and she's about 5 weeks out, and you can see her profile here that has been restored beautifully as well. And so in conclusion, we have a very special guest here who I wanted to introduce. Hi, honey. Oh, did you want to sit here too?
I couldn't.
Oh, you can roll this hair. Okay. So I actually brought in Ashley just to say hello, and I dragged her in. She's working, she's directing my OR right now, but she is about 4 months out, and I just wanted to ask you how you're feeling.
Oh, I feel great. As you guys can see, like my before photo,
Which is beautiful.
to now. Oh, I know. Looking at it, I'm like, wow.
It's, yeah, like there's a little change.
Oh, I think it's a huge change.
How's
But
your
it's still,
recovery?
my recovery was a piece of cake.
Good.
Piece of cake. I had very minimal bruising. I had actually just a little bruise under my
Yeah, I
eye,
remember that.
and that was it.
That was it.
I was terrified to actually have it done. I, for the last, I think like 13 years, 12, 13 years,
Yeah.
I was getting filler
That's
put
right.
into my nose to
Mhm.
straighten out I had a, as you can see, it's a bump there.
A little one.
But, and not that that was painful either, but I just didn't want to have to do that anymore. But I was terrified to have a rhinoplasty because I was scared of not being able to breathe
Mhm.
afterwards, or
How long did that last? Like a week?
no,
Few days?
I just feel like that was just maybe the first night,
Mhm.
and then the next day I was fine.
Yeah.
Yeah.
And you're about 4 or 5 months out. The tip looks real cute to me.
Yeah.
Do you feel like it's a little bit swollen still?
Yeah, I still feel swollen on this side here. Like
Mhm.
a bit of like that spongy texture feeling, but this one feels nice and smooth.
Mhm. I think she
I
looks
love it.
gorgeous.
Thank you.
Thank you.
Thank you.
Okay, and that is pretty much our conclusion. Thank you, my wifey, who's my gorgeous wifey. And I'm open to answer any questions. And again, thank you again. And we do have a promotion here for you attendees. We're going to keep your nose on the horizon for the future. Things are looking uppity and great in 2021. And we do have, let me just put that back up, but essentially the $1,000 off for the rhinoplasty procedure, if we can get that to stay.
Excellent. And if anyone has any questions, just go ahead and put them in the question and answer portion there. If not, you can always shoot us a text, send us an email, schedule an appointment, give us a call, and we're happy to answer questions one-on-one. So someone is asking Dr. Park, what is the price range? And that's typically something we want to answer within the consultation. Is that correct?
Yeah, and I can give you a general range. I think my patient care coordinators will give you exact details, but the range would be anywhere from 7,500 to about 10,000. Again, it really depends on what we're focusing on, but that's probably a general good range to start with.
Perfect. Another question is, will they have black eyes after the procedure?
That's a very good question, and I'll kind of go back to, it really depends on what I am doing with the bony work. So as for an example, if we go back to this particular slide, if I do need to make these little bony cuts here, then that can kind of cause a little bruising into the lower lids right there. So if that's the case, that bruising usually stays for about like approximately 2 weeks or so. But the point being that if once the splint is off in about 6 to 7 days, then they're free to cover it up and wear makeup and go out into public where no one would notice.
Perfect. And from your experience from talking to patients, on a scale level 1 to 10, pain level for the whole procedure and recovery?
Yeah, I'm often really surprised at how little pain almost every patient comes in with. I would say facial procedures in general are relatively very painless as compared to body, breast augmentation, or tummy tuck. But I always ask them how they're feeling, and pain is, they may take 1 or 2 pain pills, if that. and literally by day 2, they're off pain medications. Most of the sensation is the feeling of stuffiness and congestion for a few days, but again, that subsides very quickly. So people are back to their normal activities very, very quickly.
Great. How long does the surgery take?
If everything is relatively straightforward, generally this procedure will take about an hour, plus or minus 30 minutes. Sometimes there needs to be extra work. Again, when we're sculpting, just as you're sculpting a clay pot, sometimes there's intricate details I need to address. But on average, about an hour is pretty good enough time there.
Great. And are there ever any breathing issues, or does rhinoplasty help with breathing issues?
Yes, so that's a very good question, and that's really important. So one of the very first questions I do ask is the history of if there's any obstruction or airway issues. If in history that a patient does mention that, I really probably would have them be seen by ear, nose, throat, ENT, in order to make sure there's not something not deep inside. It could be the bone or sinuses, or even the septum, which is the middle cartilage that can be kicked over. That's more of a functional issue. And if that's the case, I do like ENT to kind of address that. And they can do that either before or after. But as far as my work in procedural, I'm working on the outside, so I don't necessarily really affect airway or improve or make worse the airway.
Perfect. And someone wants to know, will they be asleep during the surgery?
That's a very good question too, because interestingly, I didn't really go into too much detail, but I do a closed approach so that scarless, there's no incisions. Some people will open the nose and they'll make a scar and open. I feel no need for a scar and we don't want extra swelling. So as a closed approach, I actually kind of learned certain techniques from my surgeon, Dr. Sorosky, who retired long ago. And he used to do these under a conscious sedation. And it was a little bit daunting because when I would do the bony work, the patient would, might feel it a little bit. So the short answer is we're definitely going to do general anesthesia now. And that's where you'll meet Dr. Eric, who again had her procedure 5 weeks ago and did phenomenally well. But you'll probably want to be asleep for that quick hour during the whole procedure.
Okay, great. Someone wants to know, will they have to wear bandages during recovery?
Bandages, not necessarily. However, I do apply that splint, and you've probably seen him in the movies, but it's a very small plastic splint that's molded specifically to your new bridge. And so that's what you wear for and hide out for about 6 days on average. And then that comes off, and then we're able to, again, get right back into the swing of things right there.
Great. It looks like we have a couple questions about specific situations. And for those, I would recommend definitely give us a call or come in for a consultation. We can answer those more on a one-on-one basis. And I think that looks like all the questions.
All right. I think I see one. I'll just answer this last one, that if you don't mind, Elaine.
Oh, yeah, absolutely.
Because it brings up a very good point. A patient did ask about trouble breathing as well as the thickness of the skin. And I think what I was alluding to in my talk was that as far as breathing is concerned, again, if there's any breathing issues, I want ear, nose, throat to take care of that functional part. But in terms of the thickness of the skin, I would reiterate, everyone's skin is a different thickness. And so mine is medium thick. Again, if I'm going to work on my cartilages, if I have my nose with a little bit thicker skin, I am going to get a little bit more of a conservative result versus, again, my wife, who has very thin skin, and I work on her cartilages, that very thin skin is going to drape very nicely over her result. And so, yes, the thickness of the skin does vary in terms of how much of a change or a result you're going to see. So that's something I try to talk with to the patient as well.
Excellent.
All right.
Great. Well, if